Namaskara and welcome everyone. My name is Dr. Rasmi Palassery. I am a pediatric hematologist, oncologist and a bone marrow transplant physician working in the Center for Hematology and Bone Marrow Transplant at Ramaiah Memorial Hospital. Today I want to take you through the particulars of what a family needs to know or has to go through as they take their child towards a bone marrow transplant. So bone marrow transplant or hematopoietic stem cell transplant is a curative treatment for different types of disorders. In the olden days, predominantly it used to be done for blood cancers like leukemias when they couldn't be cured with chemotherapy alone. But nowadays, bone marrow transplant is a curative treatment for a lot of bone marrow related problems or blood related problems like thalassemia, sickle cell anemia, bone marrow failure and immunodeficiencies. And bone marrow transplant has gone above and beyond just taking stem cells from a donor and giving it to the patient to something called cellular therapies, where we take the patient's own stem cells, engineer them to cure the disease and give it back to the patient. So this is called cellular therapy. So what do families go through or what do they have to face as they prepare to have their child undergo this complex procedure? I think we can discuss it under three headings. So there is a clinical part, which is what I deal with as a physician or a transplant physician. So this involves making sure that the child has a disease for which bone marrow transplant is a cure, and then and figuring out how to do this transplant. Is this transplant going to be done with child's own stem cells or is it from another healthy donor? If it has to be from another healthy donor, which we call as an allo transplant, then we have to look for an allo donor, in which case it is either a sibling who is either a full match or a half match. We do this HLA matching technique, or it can be a parent, or in certain cases it can actually be an unrelated person who has registered in a donor registry and pledged to donate their stem cells when required. So while the clinical aspect of curing the disease, preparing the patient, identifying the donor, all of that happens, there are two more aspects that we need to be aware of. One is the psychological aspect, and this is very important for the patient as well as for the family, and in certain cases when the donor is a family member, either a younger sibling or parents. So the psychological stability from the beginning is focused on. In our institution, we engage a psycho-oncologist as well as a psychiatrist from the beginning of the transplant talks with the patients, where they provide their assessment and do the necessary care before the transplant happens. And the third and the final aspect is the financial aspect. Transplants are expensive, complicated procedures. There is expenses involved even after transplant in terms of post-transplant care. We have our state and central government sponsoring transplants through various government insurances. Our institution has tie-ups with a few NGOs that do help children financially through transplants, but all said and done, it is still financially unreachable for a large chunk of our population. So once these three parts of a pre-transplant journey are addressed, then the child proceeds towards the transplant. So the child will be admitted to the transplant unit. There will be a preparation of the child's body where the child's marrow is removed by a combination of chemotherapy, radiation and immunotherapy. There is no surgery involved in this, unlike some of the other transplant. The stem cells are collected from the donor and it's given back to the patient. So there is a period of about 3 weeks to up to 4 weeks, during which the stem cells go inside. It's given just like a blood transfusion, again no surgery involved, and it populates the patient's marrow and makes the blood cells come back to a normal level. And remember, these are healthy stem cells, so whatever is the disease for which the transplant happened should be cured by now. But the journey doesn't stop there, because we want to make sure that this new blood cells and immune cells that has come inside the patient settles in nicely without too many side effects. So there is a period of about 6 months to 1 year during which the patients are rigorously followed up. They will be on various medications, there will be a lot of investigations done, and once the success is definite, and the patient shows no signs of any immediate or long-term side effects, that is when we call the transplant as successful. So all of this may make you feel like this is a complicated procedure, this is quite risky, but overall the outcomes of transplant, especially in children, are very high. At our center, we are actually auditing our transplant outcomes at 100 days after transplant, 1 year after transplant, and 2 years after transplant, and reporting it to global accreditation agencies. And we have been recognized as FACTA accredited, by which we are showing that our standards, not just in terms of how we do transplant, but also our outcomes, are at par with the global standards. So I just want to end this conversation by saying that it's a very anxious period for a family as they prepare to undergo a transplant for their young child. But as an institution, as physicians, as caregivers, we will be there with you throughout this journey. Thank you.